Good morning, class. My name is Olivia Akoth, your usual lecturer. This is Diet Therapy 3. Today we are going to learn about nutrition in cardiovascular diseases. And probably we may be interested to know what are the cardiovascular diseases. From our anatomy, we learned that we have different types of muscles, bones, all those structures that form the muscles, the vessels, the bones, the tendons, all those are in the musculoskeletal system. So even the musculoskeletal system, from time to time, get particular diseases. So we are going to learn about the nutritional management, symptoms, risk factors, and also the medical remedies for 4 major conditions that we can say are nutrition, can be managed also in nutrition ways. These include osteoarthritis, rheumatoid arthritis, gout, osteoporosis. Now, let me reduce my face so that we can measure on the slides. And on your window, on the upper left, you will be able to see the slides of what we are going to talk about. Let's look at expected learning outcomes. By the end of this class today, I expect each trainee to be able to explain etiology. Etiology is like the causes, clinical symptoms, medical nutrition therapies for the common musculoskeletal diseased patients. And I have told you that these diseases that we want to cover today are osteoporosis, rheumatoid, osteoarthritis, and gout. And as you see, these are conditions which are not caused by any bacteria, any virus, or any other microbial agent. Rather, these are conditions that we call chronic conditions. Their onset is slow, but once they come in, mostly we are unable to completely treat, but we can manage and live with the conditions. Therefore, approaches should also include prevention before occurrence. That is, because most of these diseases that we're talking about occur with age. We must try to follow dietary regimes for prevention so that as we are aging, we minimize our risk of suffering from these conditions. Let's start with osteoporosis. What is it? We find that osteoporosis is a disease in which bones become fragile and likely to fracture. Usually, the bone density is lost. Density, we can say like, let's use, for example, charcoal. There are trees which have heavy charcoal. There are trees when you burn, they have lightweight charcoal. This is how our bones behave. When we suffer from osteoporosis, our bones become lighter because the density, the heaviness has reduced. And because their density has reduced, they are more easily prone to fractures. And this may be attributed to, one, the body has failed to form enough new bones, especially as we age. Number two, there may be too much existing bone which is reabsorbed by the body. Especially in pregnancy, the calcium requirements of the child, when not met in the diet, is retrieved from the bones. And that is why after pregnancy, a mother is advised to plan for some years to conceive again, so that they are able to replenish, for example, calcium, which may have been, reabsorbed by the body from the bones. Or it may be that one person is having low density of their bones because of the both reasons: failure of the body to form enough new bones, and also too much reabsorption of existing bones. So, for our bones to form adequately, we need to take adequate nutrition. And specifically, calcium and vitamin D are required for bone formation, so that we are able to, our bodies is able to facilitate mineralization of bones and also to form new bones. Now, these two nutrients, sometimes the body may fail to have them due to poor dietary intake, a diet which does not consist of calcium and vitamin D in adequate amounts. Also, it could be due to malabsorption. It could also be that the nutrients, the calcium and vitamins, are taken in dietary intake, but are bound by other factors like zinc bind calcium, like excess fiber, excess phytates and oxalates in the diet, so that these nutrients, especially calcium, is not bioavailable to the body. Clinical symptoms of osteoporosis include pain almost everywhere in the spine. There may be reduced height. Originally you are tall, and then now you are becoming shorter. And we have seen that people who are aged become shorter and shorter, and some may start stooping, walking as if they are bending. How then do we treat osteoporosis? Osteoporosis is treated by the doctors giving what we call biophosphonates. Also, hormone replacement therapy, where especially women are given estrogens, and other calcium boosting drugs like calcitonin and corticosteroids. Now, what is our role as nutritionists? We must put these people on high calcium diet and also high vitamin D diet. The goodness with vitamin D is that it is obtainable from the sun. So we can also manage this patient by providing a supplement consisting of both calcium and vitamin D, and also advise the patient or the client to increase their dietary intake of calcium and vitamin D. The best source of calcium in our diet is milk and milk products like cheese, like yogurt, Also, we have calcium-enriched soya and certain fish, especially the fish we eat with its bones, like the omena, the fulu we eat when it is still young. We can be able to fry it, we can be able to eat the bones. So, as nutritionists, because we are likely to meet clients who are suffering from osteoporosis, it is important to always just know that we must tackle calcium and vitamin D. And we are going to meet these people who are, mostly such people are aged. One of the risk factors of osteoporosis is aging. Another risk factor is being a woman. Another risk factor is the number of children that a woman has given birth to during their fertile years. Gravida. If you are gravid 2, gravid 3, somebody who is gravid 8 is more likely to suffer from osteoporosis, especially if a boosting diet did not follow. Let's now cover rheumatoid arthritis as the second disease. And we have two types of arthritis. We have rheumatoid arthritis and we have osteoarthritis. Rheumatoid arthritis is whereby, the body cells detect certain cells in the body as strangers, so that the body develops a false autoimmune response, which causes inflammation. Yeah? So the immune system attacks healthy cells in the body by mistake, causing inflammation in the affected parts of the body. It is commonly, the parts that are affected are our ankles, the joints, yeah, the wrist, the ankle, the wrist, yeah, the knees, and sometimes it spreads to other parts of the body, including other body organs like lungs, like the heart, like the eyes. Now, the tissue joint which is affected experiences pain and sometimes goes into remission, period which the patient does not feel pain. It means anybody with rheumatoid arthritis, sometimes they can see inflammation and it is painful. But sometimes, after some time, the inflammation is gone and the pain is gone. This is the period in which the body, the arthritis status has gone into remission. It does not react to other cells anymore, but then it goes and comes back. So there are these periods where they experience extreme pain, and they have these periods where the pain is gone and they feel normal. The signs and symptoms of arthritis include pain or aching in more than one joint. It could be in the knees and in the ankles and in the elbow joint. Then tenderness and swelling in more than one joint. And most of the time, it's both joints on the both sides. Like if it is knees, it's both sides of the knee. Weight loss, fever, fatigue, and tiredness, and also general weakness. There are risk factors for developing rheumatoid arthritis. Risk factors will say that if we have been practicing these things in our lives, we are more likely, or if we are at this stage, we are more likely to be talking about arthritis. And if we have been smoking, if, for example, as a woman, we have never given birth, we are likely to suffer from rheumatoid arthritis. Obese persons who have BMI of more than 35 are at higher risk factors of developing rheumatoid arthritis. Early life exposures. If as a child you live with parents who used to smoke, then they increase your risk of developing rheumatoid arthritis. Age. The more we grow older, the more likely for us to develop rheumatoid arthritis, and also sex. Rheumatoid arthritis occurs more in women than in men. Now, medical treatment, it is important to note that rheumatoid arthritis cannot completely cure. It can only go into remission during certain periods. But medication can be given to reduce inflammation and pain. And so what is the nutritional management? Our goal in nutrition management is to prevent malnutrition and encourage the person to eat adequately. So in these kinds of patients, we have increased protein to 1.5 grams per kg of body weight. If the person is experiencing undernutrition, and during the time that we say the rheumatoid arthritis is active and is causing inflammation, then during this time we give the person 1.5 grams per kg body weight of protein. We restrict sodium to 2 to 3 grams per day due to fluid retention. We ensure adequate intake of vitamins and minerals, especially vitamin C, pyridoxine, vitamin D, potassium, calcium, selenium, and zinc. We increase consumption of fish and seafood, and also include omega-3 fatty acids in the diet to help manage the inflammation. So we can also just give 7 C's as a fish oil which can be obtained from the pharmacy, a supplement which can be obtained from the pharmacy. We also manage any other side effects that may be caused as a result of taking drugs during this period, like nausea, like lack of appetite, etc. We must ensure that this person takes adequate vitamins and minerals. Now, I told you that we have rheumatoid arthritis and we also have osteoarthritis. Now, osteoarthritis is not an autoimmune response. Rather, it is a joint disorder due to degeneration of articular cartilage and bony outgrowth around the joints. It is also painful, and most of the time people who suffer from osteoarthritis are aged. And also, it is more common in obese persons. Risk factors for its development include age. It is common in persons who are 50 years and above. Being obese, because extra weight in our body usually causes wear and tear. Genetics, meaning maybe in our lineage, somebody suffered from osteoarthritis. Injury of the joint, especially when you are doing sporting activities. I'm sorry for the font of the slide. Probably in the notes I'll give, you'll be able to see bigger ones. I forgot to edit into bigger fonts. But let's just continue. Now, symptoms of osteoarthritis include pain and stiffness in the joints, rubbing, grating, or cracking sound when joints are moved. Medically, osteoarthritis is managed by use of non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, and all that. Corticosteroids can be injected into the joint to reduce swelling and pain. And also creams are available that can just be used on the surface. Nutritional management. For those who are obese, we must work out a weight reduction program and including exercise. Staying active and getting exercise to maintain joint and overall movement. We have to ensure that the client has adequate intake of calcium and vitamin D. And also, we encourage taking of high sulfur-containing foods, because they repair and rebuild the cartilage and connective tissue. These include, but some of the foods that are rich in sulfur are eggs, asparagus, garlic, onions. These are foods which are rich in sulfur. Supplementation with sulfur, vitamin D, and calcium can be done to patients who are actually not sure of their dietary intake. We also encourage intake of bioflavonoid-rich foods, and these include foods like citrus fruits. Lemon is a citrus fruit, orange is a citrus fruit, pineapple is a citrus fruit, passion fruit is a citrus fruit. Green leafy vegetables, even kales, collards, spinach, all these are green leafy vegetables. The ones we cook traditionally like kunde, like pumpkin leaves, flaxseed, eggplant, etc. They bind and strengthen the collagen structures needed for healthy connective tissue. Saturated fats must be eliminated or reduced in the diet, and then we must include more alkaline forming foods like the green leafy vegetables we are talking about, cauliflower, broccoli, citrus fruits, seaweed, sea salt, root vegetables, nuts, onions, garlic, and ginger, organic fruits also, and vegetables. We have talked about including also supplements of calcium, vitamin D, the B vitamins, zinc. All these are good for the cartilage. Avoid gluten. And reduce intake of acid-forming foods, such as tea, coffee, red meat, biscuits, cakes, porks, etc. Now, let's look at gout. Gout is a disorder of urine metabolism in excess, characterized by abnormally high uric acid levels in the blood. And so, we have two types of gout. We have primary and secondary gout. Primary means it is being formed due to our dietary intake, and excess or abnormally high uric acid levels are existing in the blood. Remember, these occur after a long period of time. Secondary gout occur as a result of another existing disease, which is making the body have high uric levels in the blood. The risk factors for gout: poor diet. People whom their lifestyle include alcohol, red meat, are likely to suffer from gout. Purine also actually exists in the small fish, the omenas we tell. Too much of it is not good. Obesity, obese people are likely to suffer from gout. Genetics, if in your lineage there was somebody who suffered gout. Sex, uric acid level increases at puberty in men and at menopause in women. Men may have gout at an earlier age than women. And also race, Americans are more likely to suffer from gout than Africans or Kenyans. So, symptoms of gout. Pain in the joints, pain and or swelling in the joints, and also pain that comes at night and it's very intense. Yeah? Rapid increase in discomfort lasting for some hours. So as the gout subsides, the skin around the affected joint may feel itchy. Very red or purplish skin around the affected joint, and then limited movement of the affected joint. Gout we can treat by administering anti-inflammatory drugs. And the nutrition therapy for gout, we recommend purine-restricted diets. Yeah? So meaning we avoid or eliminate foods that have purine. High carbohydrates and low-fat diets, and if fat is included, we select from mono and polyunsaturated fatty acids. So remember we said one of the things you need to do is to, eliminate purine in the diet. And so these are the foods to avoid: beer and grain liquors like vodka, whiskey. Then red meat, lamb and pork we try to avoid, especially the roast ones. We also try to avoid organ meats, liver, kidney, or at least let us reduce the amounts in our diet. Reduce seafood, especially shellfish, shrimp, lobsters, etc. We have to take a lot of water to prevent the concentration of uric acid. And then we maintain desirable weight, not obese and not underweight. And so we come to the end of this class, and I want to leave you the following questions to answer. Discuss the causes of gout, differentiate between rheumatoid arthritis and osteoarthritis. Discuss the nutritional management of osteoporosis, rheumatoid arthritis, osteoarthritis, and gout. And Achando, if you are listening, please do this quiz and submit before Monday next week. Until next class, I want to thank you, and we meet in the next class.